First, I need to get a motion to approve for member Allison to join by phone. First by member Daly and a second by member Duncan. Has everybody voted? Member Alsasser. Member Alsasser is an aye? Yes, please vote. That should be it. Yep. Okay, welcome member Allison.
Thank you.
All right, next we have the approval of minutes of December 3rd. Can I get a motion? Member Coates? Member Blair? A second? Please vote. Are there, I guess I didn't ask if there are any corrections. All right, go ahead and vote. Member Allison?
Aye.
Oh, member Alsasser, aye. Okay. All right, we'll move right to the informational items. And first we have the Board of Health. Oh, hi, Monica.
Hi. Good afternoon. Just a quick little bit of update from the Board of Health. Well, first and foremost, we have been in our facility for a week, and knock on wood, it's been going great. So we are very excited to have everything under control, be under one roof, and really start focusing a lot more on some of our processes and just programmatic updates. With that, our Board of Health did meet last night. They appointed a new board president, Ben Brewer, and a new secretary, Dr. Jim Davis. And additionally, during that board meeting, they did approve us moving forward with 2 contracts, and a shout out to Jenny and Mike from the State's Attorney's Office for working with us on these contracts. One was Heartland Health Services for the lease agreement in our clinical space, and the second is with OSF St. Francis Medical Center Dental Residency Program, which will begin providing services on Monday after a brief blessing by some of their team members. And so we are very excited to bring those partnerships on board and online. Overall, I think, and maybe if this has been discussed in other ones, with the federal news that came out today, a lot of our focus and our calls this morning with a lot of staff leadership as well as state leadership has been really discussing how health departments, especially ours, being funded 60% by grants, how the impact will look for us and kind of the timelines that we are waiting for. I know our team has been evaluating all of our funds and also working with Heather on recognizing that some are direct federal funding, others are passed through, and others completed by the state. And so we are trying to kind of make sense of where we're going to land with any of this. More than happy to answer questions.
Yes, member Blair.
Along those lines, we know that there's an executive order for the United States to no longer be a member of the WHO. Does that have any impact on us locally?
I think where it matters locally will really be on consolidated communications as well as collaborative efforts. Communicable diseases are not focused on or care for jurisdictions. We've seen it for West Nile virus, Zika, and right now H5N1. And so a lot of our data sources, even thinking of something such as like influenza, we know how our influenza happens here in the US because of global monitoring and surveillance that begins in South America. So right now, a lot of you might be knowing individuals that are suffering from influenza A. That data source is something that has been coming from us, and that's where the WHO plays a huge role in collaborating and being able to support data-driven decision making. So there is going to be an impact locally. Likewise, it does flow through the CDC, and so a lot of the burden will come now from us to piecemeal together information based on our local surveillance, partnering with our state, even other states around us, to really come up with a better understanding of what's on the horizon. So there will be challenges for that. But I think what's really important to recognize, though, is similar to communicable disease or diseases in general that don't look at jurisdictions, they're not crossing the river, things of that nature, so to speak. Science also is not done in a vacuum, nor should it be done in a vacuum. And so the good part about that is that we'll still have access to scientific information, peer-reviewed research that, again, is data-driven. And so, again, the challenge will be to consolidate and have that technical expertise. And that's where I think we're going to see some of those challenges.
Great information. Thank you. Any other questions? I did see, and this was Member Alsasser, that the health department has a call for nominations for Public Health Champion Awards. And I know when we were talking about the naming of the building, you had somebody in mind that you wanted to name the building after, but this might be a good opportunity to submit that person for recognition from the health department. Thank you. All right, next, EMA. Oh,
I'm also being
okay.
EMA for the day. In your packet, you'll have the monthly report from Jason. One of the projects, though, he did want to highlight is we're starting to do some data collection and understanding of our communication network for emergency management, which, of course, part of that is around our siren system or outdoor warning system. I know enough to be dangerous, so please definitely email Jason any follow-up questions. But when you look at one of our outdoor warning systems, it's really made up of three components: a radio, a siren, and amplification. Our radios, which relay messaging to issue those sirens, is starting to age out, and the infrastructure and replacements are starting to age out. And so long-term, starting to plan on what does it mean to replace. Are we replacing one-to-one? Are we potentially looking at increasing the amplification or the actual sirens to potentially cover a larger jurisdiction and then eliminate one that may be overlapping? Also, are they positioned in areas that potentially were maybe much more outdoors or rural, but now are urban centers and may have relied on different systems? And so this is just the initial starting process. We recognize this is going to be a long-term project, one that we planned out for, but working with an internship opportunity that came through the county, we do have 4 interns that will be looking at not only the siren, but overall just emergency communication.
Okay, thank you. Any questions on EMA? You can email them to Jason. Thank you. All right, next we have care and treatment. We have a guest today to talk about care and treatment. Welcome, Mr. Baker.
Hi, thank you. Chairman Renault, Todd Baker with the Care and Treatment 377 Board of Peoria County. Your board is made up of myself, Will Hayes, Cliff Lane, and Alyssa Neumeister. Alyssa is our current chair, but unable to be here, so she just tapped me out and had me come in. We have an open seat, and Chairman Dillon's working on that seat. We, for the 24-25 year, funded 6 agencies at about $1.6 million to purchase services for developmentally disabled people in Peoria County. Our RFP for 25-26 will post on February 1, and we will get our responses in by 4:30, and then at our meeting On 5/21, we'll have a grant presentation and a review, and we will hopefully be voting on the grant rewards for 25-26. The budgeted amount will be a little shy of the 1.6, but it'll be fairly close. We've been working historically on getting our balance spent down. I know Administrator Sorrell's been working with me on that, but it's not a terrible problem when the revenue side is larger than you expected. But I think we've got a handle on that and made some headway. So I'm open for questions.
Thank you. And for those, I'm not sure if everybody's aware, the care and treatment has its own tax levy. They can only be used for care and treatment, so it can't be transferred to any other funds. So it's up to you to spend those funds for us. So I wanted somebody from care and treatment to come and speak. We haven't had anybody for a while, just in case members had questions about, maybe aren't quite familiar with what all that they do. But Mr. Baker's here if you have any questions. Somebody has to have a question. He came all the way here. Well, thank you for coming. We appreciate your time.
Thank you. Happy to do so. We'll be here quarterly.
Oh, sounds great. Thank you.
Thank you.
All right, next is the Regional Office of Education.
Hey there. Short update today. We have 3 grants that are impacted federally. One is Department of Homeland Security Safety Grant that will be frozen. One is Unhoused Students, the McKinney-Vento, that supports our homeless students. And the other one is a grant that we're not fiscal agents of, but that we work with ICC on apprenticeships, internships, and job shadows for students, so that they can get opportunities in college and career readiness. So yes, I'm working on that myself today. Let's see. So last week, I just wanted to remind you that we were the recipient of more funds for early childhood. So we opened new classrooms. We have 3 up and running, and that was able to get quite a few children off of the waiting list. So we're very happy about that. And then before I turn it over to my colleague, because obviously the last month, you guys, the new facility is just awesome. I don't know how to tell you how it impacts being in a space like that, but the impact is real. And I can hear the people coming in and what they're saying and our testing clients. It's just so cool to be a part of. But before I turn it over to my colleague Kara here about attendance and truancy. So you are the recipients of our newsletter. We send it out to everybody. We have quite a large net that we throw out there. And I know you get emails like that all the time. But if you go back and open it, it features one of our students who has incarcerated parents, that one of our truancy student support specialists was able to make a relationship with grandma to get to the student and finally get him back in school. And he's a basketball fanatic. So he was able to get his picture taken with the Manual basketball team. And then I was present when Peoria High played Richwoods. 8th grader from Markville was rewarded with being an honorary ball boy because his attendance went from like 0 to attendance, like he was back in school. He got to run out with the team. He was rolling the cart with the balls, and his student support specialist is the voice of the Lions. So he even announced him, and the kid didn't want all the attention, but he announced him and thanked him for his approved attendance and whatever that night. And that was really cool to see. So whatever it takes, basketball doesn't work for everybody, but it works for some. So whatever it takes. And then she has some updated numbers since we have a gap in when we've seen each other because of the holiday.
Good afternoon. I just wanted to update you with some numbers because the ones that you have in front of you are from December 12th. So currently we do have 566 active referrals. We have over 3,300 home visits that we've completed, over 1,200 calls, texts, and emails for parent contacts. And we are getting ready to actually start to exit some students, which is awesome. That means that they have consistently improved their attendance. We require them to have 80% attendance for 2 months or more. So we our student support specialists work with them. We monitor them on what the student support specialists monitor them daily, but I watch them on a 2-week cycle. And if they have that 80% or more for 4 2-week cycles, then we discuss exiting them based off how the student support specialist feels about their progress. If they think that it's a good idea, then we can exit them. If they think that they need more time, then we leave them on. So when I come back next time, I'll let you know how many students we've exited. And we've had 19 families come to the Truancy Advisory Board. We do that every 2 weeks down at the Crittenton Center. We just meet with families to discuss what barriers they're facing. We've currently, offered families counseling, food pantry, supplies such as air mattresses and bedding. CCBYS through the Children's Home is a mentoring program. We've gotten several students signed up for that. And so that's kind of where we're at with truancy. So I just wanted to give you a few updates.
Thank you very much. Any questions? Yes, Member Blair.
This may be more for Scott, but do we have plans for the space, the old ROE space? Can we, if people have suggestions, like a nap room or something, who do they send those to?
In the short term, and I would define short term probably for 18 to 24 months, it's going to be temporary office space as we remodel various offices in the building. So that's going to include probation to start with. Circuit clerk may also have to work out of that space as well during their remodeling project. Long term, we want to take some time and be thoughtful about how we would use that space. There are a lot of different ideas that I've heard anecdotally over the course of time. So if there are suggestions, they should be forwarded to me, and we'll take them and consider them.
Whose authority is it to decide on space? Is that ours, yours, somebody else's?
I mean, if we need to remodel that space to accommodate some new functionality, then that would be the policy decision of the board to budget for that and then approve a construction contract. No existing office or department in the organization can lay squatters' rights to it, for example.
Well, thank you both for coming today. I do know, the work that you're doing is getting noticed outside of this room. I know when I watched the mayoral debate the other day that a couple candidates sang your praises about what the work that you're doing. So thank you for everything you're doing. Appreciate it.
Thank you.
Okay, sustainability. Welcome, Becca.
Good afternoon. I just have a couple quick updates. Electronics collection, same as before. Just a reminder, we do opt into the Consumer Electronics Recycling Act program. We have a few switches of partners, which is great to expand sort of our reach in terms of those one-day collections for electronics. Hazardous waste collections have started to be scheduled, and that is an extension of the landfill agreement. GFL will be managing those hazardous waste collections, and 3 of those are scheduled already in locations. So those are listed in the packet. Holiday Light Recycling concluded. That's a program we've done since 2012 and expanded in a number of different ways. This year we collected a little less than previous years, the previous year, but still pretty steady along with others. Added composting of Christmas trees. That was something that was discussed last year. An outlet. The city does have tree collection as part of their contract. Those are going to the landfill. This was a way for us to avoid sending Christmas trees to the landfill, find a better use for them. So we did partner with Soil and Water Conservation District in terms of drop off for those trees, and they were removed for aquatic habitat. And then we also partnered with IDNR for next year because they can take 1,000 trees. for Banner Marsh or more. So we have that extended partnership going forward, which is very exciting as an improved use as opposed to going to the landfill. Landfill committee, there was an error. I apologize. The next meeting is February 19th. That was an error on my part. I apologize for that. Regional Food Council, the next meeting is February 7th. Tomorrow and the next day, there's the Illinois Farm Bureau does a huge everything local conference that lasts all this week. I'll be attending tomorrow and Thursday and speaking tomorrow. A couple of people from the health department also participate from a food safety standpoint as well. Sustainability update, just moving forward with the conservation block grant planning in terms of the sustainability team meeting. With that funding being a federal, it is through the IEPA, but it's a US EPA program. I don't know if they have the money in hand and then are passing that through, or if that grant will be affected as well. That's $100,000 to the department. And that is all I have, unless you have questions.
Any questions? I'm pretty sure I'm the reason why we didn't hit our quota for the lights. I've got like 3 bags sitting on the floor of my garage.
I can still take them, or you can take them to Alter Recycling year round, or Kusakowski Recycling year round.
Oh, okay, good.
Yep.
We'll do that. Thank you.
Sure thing.
Any other questions?
Mr. Chairman, before you go to the ombudsman, I just wanted to Member Williams and I have already talked, so let the benefit of the committee know, and then also those of you that are on Finance Committee, I'm going to ask for a special joint committee meeting the day of the board meeting on the 13th. We're going to bring forward a recommended resolution that would appropriate money from the Solid Waste Management Fund's reserves that would be intended exclusively for any interim short-term financial support for the City County Landfill Committee, which is an obligation we have under our intergovernmental agreement with the City of Peoria for the Landfill Committee. The landfill number 3 agreement that you've approved the terms for, but we still are negotiating the final details and has not yet been executed, means that payments to the county, the city, and the landfill committee have not yet occurred, and they're not going to occur until the document is executed. The city, as the fiscal agent of the landfill committee, is estimating that the landfill committee's cash reserves will be exhausted in mid-late February or early March, and landfill committee would like to hedge just in case that the Landfill 3 agreement is not executed, that they have access to funds so that they can continue to operate. Most of their expenditures are for our contract with Fourth Engineering, which is the landfill consultant that the Landfill Committee has retained. The action item would also recommend that once the agreement with GFL is executed and those initial payments are received, that there would be actually a second budget amendment that would put the unspent dollars back into reserves. And in speaking with Landfill Committee Chairman Morris, there will be an opportunity for us to negotiate with the Landfill Committee for us to be reimbursed for any funds that they would need to access.
I think that's a fair ask. Until that's executed, does that mean that the transfer station is delayed until that agreement is?
I believe they are moving ahead on the transfer station regardless. And we heard during Becca's report that they're moving ahead with the events that they're scheduling throughout the county. So they're making a good faith effort on our part. It's just their attorney, our internal review team, which includes the city manager, myself, Mr. Morris, the city's attorney, and Jenny, going back and forth and making sure that the language is where we want it. So just one of those things in terms of how the process has worked out. But I think everybody's making a good faith effort as if we're going to move ahead with the terms that you previously approved.
pretty close?
I think so.
It's literally,
Okay.
yes, it's just literally so many cooks in the kitchen. It just takes time to circulate documents, but yeah, I think everyone feels comfortable.
Okay, thank you. All right, next we have the Center for Prevention of Abuse. I swear you're here every month. Time goes by fast.
Isn't that the
Welcome.
case? You better believe it.
Yeah.
It is good to be back this afternoon to let you know what's been happening at the center with long-term care. I think everyone received a copy of our benchmark reports. Unless someone has a question, you can easily look those over yourself. I will note that without at the center, we kind of have we've got a way of wording this. I'll not say that we're fully staffed. I'll just say I'm not actively looking for anyone else to fill employment for the first time since the pandemic, and we're very thankful. I have two new full-time ombudsmen, and they are fully trained, and you can see increases in just about every benchmark that's listed. I also had a couple of my employees that are back to work after extended illnesses, so we're very thankful for that. I wanted to share a few success stories. I think that's probably a little better way to let you know what your funding helps than to give you a bunch of raw statistics that you can read yourself. One of our long-term care ombudsmen spoke with two residents who lived in a skilled nursing facility. Both residents have actually experienced great improvements in their health to the point that they both desired to be transferred to an assisted living facility to experience more freedom in the community. But both residents met resistance, both from the nursing home as well as their family members. Well, with permission from the residents, our ombudsman met with social service workers and began the process of allowing these two ladies to begin touring facilities and applying for admittance, because as we all know, as individuals with competency and direction for our own lives, we have the right to self-determination. It doesn't matter if you live in a facility or you live in a home. You can self-determine, and both of these residents were accepted into a Peoria County assisted living facility, and they are overjoyed to be living in a less restrictive environment, and they're able to get out and go shopping and dining out and meeting their new neighbors. We had another resident in a skilled nursing facility in Peoria County that had gone to the hospital, and upon readmittance to that home, the resident was supposed to receive physical and occupational therapy. For whatever reason, even after a period of time had passed, that resident did not receive their therapy. The resident gave permission for our advocacy, and we successfully advocated that the resident qualified for therapy. Their insurance allowed for the therapy. There was no reason for them not to get the therapy. And it took one full day of our intervention to put feet to the situation, and this resident had been fighting for 6 weeks to get therapy. So we're very thankful for the ability to help with that. We had a resident at a long-term care facility that was not allowed to vote. For whatever reason, the activities director, who usually handles that in a facility, deemed that this person was not competent to vote. This person had a high BIM score. That's a medical term that does an assessment for these folks to see where they're functioning cognitively and mentally. They scored a 15, which was perfect. And resident stated he was registered to vote, and he felt like his voting rights were obstructed. Resident gave our people permission to advocate, and we successfully advocated so that this resident of Peoria County was able to receive a ballot and was able to legally vote. We were able to persuade that facility to change their minds, and the ballot was received, and this resident was overjoyed to be able to vote. And then lastly, we had a resident in a skilled nursing home in Peoria County that was having severe, complicated health issues, and the resident's husband, who was also the agent under the power of attorney, wanted to receive a copy of the resident's care plan and her medical records. And state and federal regulations clearly state that residents have the right to copies of their records. And the facility, first of all, said no. And then after saying no, they relented when our people got involved and said, well, we'll let you have your records, but there will be a $25 handling fee for every page of your records, which came to several hundred pages. We were able to become involved, and they told our ombudsman, well, it's $25. That's how it is. And then they called me, and I explained to them what the law was, and they had the right to charge a reasonable and customary fee for copying. And in this area, that comes to 10 cents a copy. And they still said no. And I promptly was kind and told them, well, I'll this afternoon write a complaint letter to the Illinois Department of Public Health, and we'll let them sort out the problem. Well, Mr. Worsham, we don't believe that needs to happen. Before the day was over, that administrator shipped off electronically several hundred pages of medical records to that Peoria County family. These are your dollars that are helping our residents. Think of our people. We have 2 large facilities in Peoria County that are closing. Our people are working extensively to make sure that each of those residents is represented and goes to a safe facility. So that's all that I've got, unless someone has questions.
Thank you. Does anybody have any questions? All right. Well, thank you very much for coming again. We appreciate all the work.
Thank you.
Okay. Does anybody have anything for public comment? Miscellaneous. Okay, we're adjourned. Thank you.